Okay, well, good afternoon, everyone. Here in Ohio, it's a beautiful spring sunny day. The golden orb we haven't seen in the sky for a while has made its appearance. So hopefully after this lunch break and this call with us, you've got plans to enjoy some fresh air and sunshine in between April showers. My name is Ezra Escudero, and I'm the Director of Coalitions for Americans for Prosperity, Ohio. And it's my pleasure to introduce you to the kickoff of the 2022 CSI series, the Community Support Insider, where we bring some key policy makers, office holders, and experts to you in the community to share some inside insights on how public policy is progressing, how it's affecting our communities, and the kind of support people have for a lot of these different great ideas to get barriers out of the way of our friends and neighbors and pursuing the dreams that we have and the goals we want to accomplish. Today, we are going to be focusing on the issue of healthcare. And here at Americans for Prosperity, we have a few very simple beliefs regarding healthcare. We believe that all Americans deserve good insurance at an affordable price, access to the latest life-saving drugs at a reasonable price. All Americans deserve to be able to see the doctor of their choice conveniently and affordably. We deserve to know how much our healthcare is going to cost upfront before we pay it. And we also deserve the choice to try experimental treatments if we so desire. These options and so many more are oftentimes blocked or kept from us because of well-intentioned public policy. And we're promoting a series of reforms that will make healthcare work better for every American, which is why we're really excited to discuss the personal option today. And to help us do that, it's my pleasure to introduce Congressman Brad Weinstrom to our conversation. He champions many of the important beliefs and policies we're going to discuss today. Congressman Weinstrup was elected in 2012 to represent the people of Ohio's 2nd Congressional District. And as of the current maps, that is the area just east of Cincinnati, gateway to the beautiful Appalachian Mountains and some great scenery, especially in the fall. A lot of important businesses are down in that area. And we know they're happy to be represented by Congressman Wenstrup. He brings experience as a doctor, an Army Reserve officer, Iraq War veteran, and a small business owner. And these perspectives are so very important as he seeks to help Congress tackle the economic and security challenges we face as a nation. In the 117th Congress, he serves on the House Ways and Means Committee, which oversees important healthcare priorities. And he also serves as a co-chair of the GOP Doctors Caucus. Congressman, thank you for being here today. And the floor is yours, sir.
Oh, well, thank you very much, Ezra. I appreciate it. It's good to be with everybody today and with Americans for Prosperity. You know, I knew at a young age I wanted to be a doctor. I used to watch a show called Medical Center with my dad, and that had an influence on me. And I achieved that. I finished my residency in 1986, came back to Cincinnati, Ohio, had my own small practice for a while, solo practice, then became a partner of a large orthopedic group, which was a great way to practice. Also in 98, I joined the Army Reserve, and then 05, 06, I spent a year in Iraq as chief of surgery for a combat support hospital. I think that experience and all those experiences inspired me to run for Congress, because as I looked at Washington, I said, well, you got people making business decisions that never ran a business. You've got people making healthcare decisions that never saw a patient. You've got people making military decisions that never served. And I think that's what our founders had in mind, is to go out, get some experience in life, and then bring those experiences to the legislative table or to the government table. And we're probably better served if more and more people take that route. But, you know, we do have a doctors caucus on the Republican side. We have 18 members. It's doctors, dentists, and pharmacists. So we're covering all those that take care of patients. And that's really what we come together for. is to take care of patients. We want to be that conduit and that driving force a lot of times in Congress, and we've had some successes in trying to explain to other members of Congress how some of the decisions they make can affect patients negatively. It may sound good, may sound like you're saving money, but who are you saving money for? And are you actually making people healthier? I can remember as a group about 5-6 years ago under the Obama administration, somebody from the Center for Medicare and Medicaid Services came to speak to us. And they said, oh, all these things that we've been implementing into your practices that you have to do, electronic health record, all these things, they're really starting to work. And we all just kind of looked at the woman from CMS, and I said, well, you know why we're here? Because you've taken the joy out of taking care of people. And so on so many fronts, that has been the case. And, so we look at Pelosi's healthcare policies right now, and we really want to do just the opposite of what she's trying to do, because the things that she wants to do will limit innovation, will limit access to care, will do price controls on drugs, which may mean that we never have another new drug. But we want people to have access to care, lower their out-of-pocket costs. And we want to continue to do things that really help the medical field and really the country in general. And I'll touch on something like that when it comes to medical manufacturing and our supply chain. If you'd have told me when I was in Iraq that my protective equipment and my pharmaceuticals relied on an adversary, China, I would have said, how do we get here? But that's really where we are on so many fronts. When we did the Tax Cuts and Jobs Act and President Trump signed that, we had no manufacturers leaving the United States. Corporations all stayed. Before that, we were having what were called inversions, and people were leaving. That does not help us as a nation. So as a Doctors Caucus too, we want to focus on people's health span, not just their lifespan. We can keep people alive for a long time, but the bottom line is none of us are getting out of here alive. We want to be able to break something, and when someone breaks something, to be able to fix it. But how do we keep people healthier longer? How do we do more prevention? How are we out there making sure that people get the care that they need, even with chronic diseases, that they can have a higher quality of life until the day comes that we are taken from this earth? So there's a couple, I think one of the things that we have in place right now on the Republican side, getting ready for hopefully a takeover of the House of Representatives and gavels in our hands, is the Healthy Futures Task Force. And we've put out RFIs to a lot of stakeholders out there, caregivers and all those in the fields, to let us know what's important to you. Americans for Prosperity, your healthcare personal option, is spot on with so many of the things that we are talking about on this task force. And so it's good to have your input as well. We've been hosting roundtables, but essentially we have a few subcommittees in this. We have one on treatments, which is what I chair. And then we have one on affordability, one on doctor-patient relationship, and one on modernization, and the other on security. So what do those do? Well, treatments, as you might imagine, we want to make sure that treatments can be created. I look at, like, we have a cure for hepatitis C. People in Washington don't necessarily understand that, yes, that may be an expense up front, but what you save long-term for that patient, and they have a healthier life, and they're not in and out of the hospital, and they don't need a transplant, those things actually save us in the long run. And that goes into affordability. When you have more choice and more control over how you spend your money, we're talking about HSAs and alternative plans, and people having a choice of the type of plan that they want. And then the doctor-patient relationship, it's patients over paperwork. The government and insurance companies just demand all this paperwork, and we're more concerned about, is the patient taken care of? And so we want to streamline things like prior authorization for care. Surprise billing was something that we got done in a bipartisan fashion, and unfortunately the administration decided to change our law, which they are losing on that in court. Because the way they want it favors the insurance companies and favors unions and union cost. And we're concerned about the patients getting care. We have things like the Safe Step Act that allows doctors to decide this is the medication that you need, not your insurance company, not somebody who's never seen you as a patient. And then under modernization, it's things like telehealth, and we want to address waste and fraud and abuse. Under security, it goes back to the supply chains that I talked about, and also our preparedness for things like pandemics, and our readiness and our availability of care. Are we producing enough caregivers, doctors and nurses? Are we making it a profession that people want to go into? So I'll just kind of leave it at that, because I hope we can have some of this conversation about a lot of the ideas. And as I said, as I look at this document from Americans for Prosperity, these are a lot of the things that we're talking about, such as reducing prescription drug prices. We have HR 19 that has been teed up, and Pelosi took it off the table. Unfortunately, it was bipartisan in nature. It's about 36 different ideas for reducing drug costs. So a lot of the things, and getting things through the FDA. One of the things in here that's important to me as well is, you say, list what Congress should not do, and it says don't empower bureaucracies over the people. And as someone who represents the people and want their voice heard, I'm all for that. And we've lost a lot of that, where the bureaucracies seem to have rule of law. They have rule of law, and we try to stop them. No, we should be the ones writing the laws, and they should be carrying them out. So I'll leave it at that, which may be a good point to turn things back to you and enjoy the conversation together.
No, perfect. Very well said, Dr. Wenstrup, Congressman Wenstrup. We thank you for that, and please stay with us as long as you can. We will wrap up at 12:45 sharp. I want to make sure everyone can get back to work, finish your lunch, enjoy the afternoon, whatever the case may be. Before I introduce our next speaker, I want to put in a quick plug for our website, the personal option, or personaloption.com. Hopefully you can see it here on the screen now. And we have a wealth of information where you can come find out for yourself exactly what we're talking about with some of these ideas. So I left it on my name tag there on the screen, personaloption.com. Please visit early and often, as they say. So thank you very much. At this time, I want to add to our chat a good friend, a very smart guy, our senior policy fellow for healthcare, Dean Clancy. He's prolifically published, a great subject matter expert, and a good friend. Dean, thank you for joining us today on our call as well. And I'm going to jump into a kickoff question first. For a few decades now, healthcare talk has been very partisan and binary, with a lot of blame flying around. And very recently, the temperature has been rising in light of serious disagreements about mask and vaccine mandates and the reach of healthcare policy. At Americans for Prosperity, we believe that a solutions-led approach like the personal option can bring people back together by putting patients back in charge and removing barriers between Americans and their healthcare providers. Dean, if we can start with you first, what approaches do you find help heal the divides between people and focus our conversations on realistic solutions? What are those approaches? Oh, you're on mute, sir.
Wouldn't be a call without doing that. What our polling has found at Americans for Prosperity is that Americans have a lot more in common on healthcare than you would be led to believe by the public debates. There's a lot of polarization in the reporting, but when you poll people, what you realize that in general, they agree on some basics. And if you make your healthcare message focused on those, I'll call them more moderate or centrist messages, you'll appeal to people across the spectrum. For example, most people are basically content with their current health insurance arrangements. They do have some serious concerns: cost, lack of price transparency, the complexity and bureaucracy of our system. Congressman Wenstrup was talking about that. Those are real concerns. They're shared across the board. We've also found that people want to fix what's broken, but keep what works. So they're not in the market for a kind of complete overhaul of the system. They want to build on a good system that has some serious warts. And certain words turn out to work really well across the board. First of all, personal and personalized. People think of healthcare as personal, and they want their healthcare to be personalized. Next is choice, options, and of course, control. That's really important to people. That's why we refer to our own proposals as the personal option, because that's what people are in the market for. And it also happens to be really good public policy. It lends itself to what we need to do to give people, give you, the patient, the choice and control you want with the quality you deserve at prices you can afford from the medical professionals you trust. And that last word, trust, is also very high on people's lists. Obviously, if you go to the left of the spectrum, people will say, I trust the government a little more. On the right of the spectrum, people will say, I trust the market or individuals or myself a little more. But what they all kind of agree on is, if you have to choose between the government and your own doctor, universally they prefer their own doctor. That's where their trust is. So all of this is by way of saying, and by the way, they very much want their representatives and candidates for office to have a message on healthcare. They want to hear from you. What do you think about it? You don't have to have, I think, the world's most amazing plan, but you have to show that you care and that you've thought about it and that you have some practical solutions to make their lives better. All of which is to say, there's a lot more in common than what we normally think, and we can speak to people across the board. We can lower the temperature by proposing incremental, moderate, essentially non-partisan proposals that make people's lives better.
Thank you, Dean. Yes, Congressman, any thoughts?
Thank you, Dean. That was very well said, and I think it's true. Quite frankly, the whole conversation stems around the way it should be conversed is what I call bedside manner. And we've seen that really stripped away in so many ways. You talk about personal. I speak at graduations, med school graduations, et cetera. And I go, never underestimate the importance of holding someone's hand or the pat on the back. And it's part of your job to reduce people's anxiety. Well, see, we haven't seen that happening from the political level of healthcare. It's actually increased patients' anxiety about whether they can get care. And trust is so important. And I will tell you that, during COVID and, it was under the previous administration as well as this one, I said, America needs to be hearing from doctors that are treating COVID patients. I'm sorry, not the guy in the lab and not the politician. And we got to a point too, where the president puts out a mandate for vaccines. I'm pro-vaccine. We followed it as a doctor's caucus, the development of this. We wanted to make sure it was done right, understand the science. No doubt it saved hundreds of thousands of lives. But at the same time, we also knew that people that were vaccinated still got COVID. We still know that viruses produce variants. This should not be shocking news. We should be talking about it and preparing the country for it and the medical fields for it. But my point on this with the mandate is you have the president of the United States, a politician who has no experience in healthcare, telling you have to get this shot or you're going to be fired from your job. Where's the doctor? Where is the caregiver in all of this? And so as you talk about choice and options and control and not being controlled, there's a difference between your control and being controlled. We have steered way too far away from that. And I think people are getting that. You had people that were vaccinated saying, I don't like the way this is being rolled out, that my coworker is going to lose their job, et cetera. Have the conversation with your doctor, have that personal care where the doctor sits and tells you what the risks and benefits are for everything that you decide to do with your health care. And so we got to get back to that. And if I can say one other thing, I'm glad we live in a country that has a safety net like Medicaid. But at the same time, success is when fewer Americans need Medicaid, because Medicaid has the highest mortality and morbidity, the least access to care. Don't be bragging about putting more people in Medicaid. That means we have a less healthy nation. And I want to take care of people in need anytime. I did in my practice. But at the same time, let's have fewer people needing the safety net. And when we have fewer people needing it, they'll have more access to care, and the quality of care will be better.
Thank you, Congressman. Before we go to our next question, if I could bounce this back to Dean for a moment. You know, in the personal option, and as listed on the website, we have some policy reforms that we recommend. What impact will those reforms have on Medicare and Medicaid and the existing safety net? How would it affect that safety net should we enact some of these reforms?
Well, one of the planks of the personal option is that we support strong government safety nets. We don't want people dying on the sidewalk in this country, and happily, we don't allow that to happen. Stories to the contrary notwithstanding. We could do it better, and I totally agree with Congressman Wenstrup on this. Medicaid is a safety net that it's full of holes. It needs to be strengthened, and there are good ways to fix it and still make sure that the truly needy get the protection they need, but it shouldn't be a program for everybody. It's the safety net, not the universal program. The personal option includes some reforms that would strengthen private health care so that, in a sense, people wouldn't be as likely to need the safety net. And I'll mention just a couple of the policies. It's a 10-point program, has lots of planks. But for example, let's make sure everyone has access to direct primary care. For those who don't know, this is like a Netflix subscription to your favorite doctors. There's no insurance company middleman. Basically, the doctor gets to be a doctor instead of an insurance company bureaucrat, and you get time with the doctor. That's better health care, and everybody's happier. This is popping up all over the country. There are some overzealous regulators who would like to, in effect, regulate direct primary care out of existence because they view it as if it were some kind of insurance plan. It's not. It's just the direct provision of medical care. It's old-fashioned medical care. DPC doctors, they do telehealth without even thinking about it. It's not a barrier for them. They even sometimes make house calls. How long has it been since we had doctors making house calls in this country? That's just one thing. A second one, and then I'll stop. Health savings accounts. Tax, and I think Congressman mentioned this. This is just designed to help you have more choice and control over your healthcare purchases. It's a tax-free account that in effect gives you a discount on every medical purchase you make because you're doing it with tax-free dollars. Your dollar goes farther. Right now, only about 1 in 10 Americans has an HSA or really has access to an HSA. We'd like to expand that so that everyone has this tool as an option. They could use that, for example, to help pay for their direct primary care monthly subscriptions. What those things do is they enable you, the patient, to shop for value as a consumer without having an insurance company bureaucrat in the exam room with you and your doctor. And doing that means fewer people probably need the safety net, but we do want a strong safety net.
Yeah, if I can add to that too, the transparency is a huge part of that. You know, too often today, people don't have any idea what their care is going to cost, even when they ask. And that's a problem. I know in my practice, patients would say, well, how much will I have to pay for this surgery, an outpatient surgery, for example? And the insurance company would say, well, just go do the surgery and then bill it, and then we'll let you know. Well, that doesn't work that well. A lot of people have to budget with their health care, and especially if you've got an elective thing, they'll say, well, I got to endure the pain a little longer till I can afford it. But they need to have that information and then the ability to use something like an HSA. But I'm also looking at things like you have people with chronic illnesses, and for a lot of people, they go, you know I should go to see my primary care doctor to make sure that my diabetes is under control and that I'm doing all the right things. And I probably should see him, but I can't afford my copay. And right now it's too tough. And so they don't go to the doctor. Well, as I talk about preventing things and being upfront and where the savings is, you know, if you prevent something, you save a lot of money. Right. So if an insurance company would say, you know what, twice a year you can go to your doctor and you don't have to pay the copay. Right. Then you know that they're going to go and get their care and hopefully prevent them from ever needing to be hospitalized. I had a primary care doctor say, you know, if I see people on a regular basis, I feel like I failed if they have to go to the hospital. So let's make sure that we have those options there. And I look at things like, look, the cardiothoracic surgeon that can save your life with the bypass graft and give you your four-way bypass and save your life. That's wonderful. That is a great skill and should be rewarded. But how about we reward some of the primary care doctors that worked with you to prevent you from ever needing that open heart surgery? So those are some ideas that we want to gear towards prevention as much as anything else, but you've got to make the prevention aspect of care more affordable, more accessible.
Amen to all of the above. Thank you both. Great perspectives. I've got one more question for you as we are closing in on time. I want to share with our audience that today's call, again, we want to squeeze into your schedules and make sure everyone can pop in for a little bit. But this is just the beginning of these conversations. I'm thrilled to announce that provided there are no scheduling conflicts that pop up or last minute emergencies, we are scheduled for an in-person policy roundtable with Congressman Wenstrup. I believe we're looking at the Loveland area. So on the northeast side of Metro Cincinnati. And I'm reaching out with other members of Ohio's congressional delegation to do other in-person events as well. So there's more to come. When we finish the call, you'll get a link to a survey, 3 quick questions. Please fill that out. And one of them, you'll get a chance to let me know if you want to keep in touch and set up an in-person event as well in your district with your elected officials. And we've been very fortunate at the federal and state level in that, some of the temporary measures that were lifted during the COVID pandemic, like telehealth and telemedicine, some of those reforms, we've already seen policymakers choose to make those permanent, to give those options back to the people, back to patients and doctors. For our other reforms, it's going to take a lot more work, the work that we're doing to help build public awareness and support. It's going to be critical for elected officials to feel emboldened. And I'm thrilled that Congressman Wenstrup's there. We need more folks fighting with you and on your side and together to make these reforms more permanent. What will it take in terms of public support building in order for these changes to come to life? And if I may, I'll toss this to the Congressman first, and Dean, you can bring us home.
Yeah, I mean, I think advocacy is huge, and advocacy in areas where we don't normally go. If you go to representatives and members of the House and Senate, et cetera, and you really break it down how your life is being affected by the policies that are in place and why the other policies are better. So I think, as I always try to talk about it, and you pretty much noticed today, it wasn't even so much about me being a physician, but it was about how it affects patient care, patients' access to care. So the advocacy from the grassroots, I think, is huge. And we don't have to do it in a screaming fashion. We just want to say, all I want to do is be taken care of as a patient in the best way possible. And so, and let people know that you do support these policies. You know how it is politically, unfortunately, for us, the other side always says things like they want to throw grandma off the cliff. They want you to die and all these types of things. As a doctor, nothing can be further from the truth. As a doctor, why would I want anything to restrict someone's patient's access to care and treatments? That's just the opposite. And I think that's the point we have to keep making and say, some of these policies aren't working. Let's do better. Let's do better for us.
Outstanding. Thank you, Congressman. Dean?
I can't say it any better, and I'm so glad that Congressman Dr. Wenstrup is in Congress. He seems to be really in touch with where voters are and his constituents on this. And that gives me a lot of hope that he'll help to shape public policy in a way that benefits everyone. Last thing, be sure to visit personaloption.com to learn more about our thinking on these issues.
Thank you, Dean. I couldn't have said that better myself. Again, we're in the business here of trying to educate our friends and neighbors, fellow Ohioans, on the great solutions that we can have to make healthcare better, and then bring those messages to our elected officials like Congressman Dr. Wenstrup or Dr. Congressman Weinstrom, and build that coalition. So again, thank you very much for joining us today. Enjoy the afternoon, keep in touch, and we'll be back out there very soon.
Thank
Thank
you.
you.
Thank you.
Bye now.
Bye.